Hello to all of those joining us. I'm Jessie Bengoa, and I'm so happy to have you here to learn with me from the very best. Today's topic is one that every horseman and equine veterinarian encounters throughout their day, even if they don't quite realize it in the moment. It's also a topic that impacts a horse's capacity for both performance and recovery, and it plays a central role in how predisposed that horse may be to injury in both the practice pen and the show ring. We're talking about core fitness and digging into just what that really means, how best to properly achieve it, the advantages of attaining optimal core fitness, really in horse and rider, and how equine veterinarians can play a key role in working with their clients to orchestrate this journey. So, when we learn about a topic here in veterinary medicine, we like to go to the top, and today is no different. So please join me in welcoming a veterinarian who is highly respected around the world for her expertise in equine sports medicine, fitness, rehabilitation, and so much more. She's a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation, and is also an associate professor in equine sports medicine and rehabilitation at the much revered Colorado State University College of Veterinary Medicine in Fort Collins. And interestingly, she is a lifelong horsewoman who quite literally has worn the crown while representing her home state as a former Miss Rodeo Colorado. Her list of achievements, degrees, and accreditations, they go on and on, but let's get straight to meeting her, shall we? She is the incomparable Dr. Melissa King. Welcome, Dr. King. How are you?
I'm good. Thank you for having me. Thanks for that quiet introduction. And I would give you a cursory Equine wave. That's muscle memory never goes away. So,
I was going to ask you if you've maintained your skills with the Queen wave. What is elbow, elbow, wrist, wrist, wrist? It's a very specific rodeo queen salute, right?
Yes, and it takes years of practice and lots of, practicing in front of the mirror, because you can't just jump on board and do it right away. So,
or at least not jump on board and do it right away successfully, right? When you hit that first corner going 9-0, leaning forward, doing your salute, bad things can happen, right? If you're not well practiced.
Got to be prepared.
Well, I'm glad you were well practiced. That's great. So there's no blooper videos or photos that are going to come next. So I'm sorry, ladies and gentlemen, but she nailed it on the word go. So now Dr. King is really an authority figure, obviously on the Rodeo Queen salute, but in so many aspects of equine sports medicine and rehabilitation. And she's helped to put this specialty on the map as one of its early diplomates and advocates. And she has a very clear picture of the importance of this area and the role that it plays in helping horses and helping riders to not only have successful careers, but really the goal is having a successful career with longevity to it, and to really add that into this horse's career. We don't want them there for a long time. We want them there for a long time at the top of their game, being healthy, being sound, being at their peak. So Dr. King, let's get right to business. I have so much I want to dig into with you today. Lucky you. And I know the audience is going to be eagerly learning today as well. So let's start with this. Talk to me about core fitness. What is it? What are we talking about here? I always like to keep a strong comparison also with human medicine, because there is such a crossover and so many similarities between horse and human. And I feel like the human core, if you will, is always mistaken for our abdominals alone, when really it's more all-encompassing than that, with the musculature that surrounds our spine and stabilizes it. So talk to me about the equine core and equine core fitness. What musculature are we talking about here? And what are the similarities and differences between human and horse when we're talking about the core?
Yeah. So I think if you look to sort of a global definition of whether it's equine or human, so regardless of the species or the discipline even, core is the ability to provide a stable platform from which to execute voluntary movements, and for the horse, of the axial and appendicular skeleton, right? And so, like you mentioned, it's not just our abdominal musculature, but in the horse, it includes the entire axial skeleton. So the neck, the entire thoracolumbar spine, the pelvis, and then it includes all the muscles that are responsible for stabilizing that. So you've got your deep epaxial muscles, such as your multifidus, and then you've got your hypaxial muscles, your sublumbar muscles, and then you have your abdominal musculature, you have your cervicothoracic musculature. So there's a lot more involved than just saying, oh, you need to work on your abdominals and then you will have gained strength to your core. Unfortunately, well, not necessarily unfortunately, but one of the most researched muscles in the horse for core is the multifidus, which is also a very frequently researched muscle in the human as well. But humans are way ahead of us as far as being able to recognize what other muscles are responsible for stabilizing your core, and a part of that core strength, or what we consider would be preparatory muscles for movement, right? The muscles that are going to fire first to stabilize and then allow your dynamic, big, powerful muscles to move and do their job. So we have in the equine literature a remarkable amount of literature that looks at the multifidus in particular, but we're very limited in our review of what we would consider other core muscles, in particular because they're difficult to get to from even an imaging perspective or from a muscle activation perspective, as far as being able to objectively assess what that muscle activation profiles look like.
Sure, absolutely. And Dr. Haley Sullivan, who was a recent resident at Colorado State University and has worked with you all, she's done some really interesting research on the multifidus as far as her program. So when we're talking about core fitness, why does this matter? I mean, what's the big deal, for lack of a better term? Why does core fitness really matter? And why does, I would assume your opinion, correct me if I'm wrong, why does the greater emphasis really need to be placed on achieving true, proper core fitness, especially in these equine athletes?
Yeah, that's a really good question. And we've sort of made some advancements, or at least in human literature, they've made some advancements in not only determining that those athletes that have weak core are linked to injury, and that when you have an injury, that if you don't come back with a strong core, you actually have an increase in the likelihood of having re-injury, even if, say, your tendon or joint that you've rehabbed from your primary injury has healed great and all of that functional aspect has come back 100%. If you don't also in that process work on establishing a stronger core, then your rate of re-injury coming back from rehab is much higher. But what they've also found is that human athletes that have poor core strength prior to starting their season increase the likelihood of having an injury during season. And some of the publications are quite remarkable, as far as it can be anywhere of upwards of a 25% increase of the likelihood that you'll develop an injury in season if you have a poor core stability or poor core strength. And a lot of those publications are looking at, in particular, the cross-sectional area of the multifidus, measuring the size of that, and then following those athletes through and making that correlation between size and the formation of an injury. So the likelihood of the importance becomes, again, sort of in what we defined in the beginning, right? The ability to provide a stable platform from which to execute voluntary movements, right? And so if the body, whether you're an equine athlete or a human athlete, you have to be able to respond to a multitude of destabilizing forces during your activity. And if you can't respond to that, or and basically those situations of disequilibrium, if your body can't respond to that, that's when you get injured, right? And so the ability to be able to have that core that's activated in preparation for those destabilizing forces is essential. Otherwise, you subject yourself, to a risk of having injury, because the larger dynamic movement muscles are not made to stabilize, right? So they're not your preparatory muscles, they're not your stabilizing muscles. But when they're weaker, then your larger dynamic powerful muscles are responsible for taking up that role of stabilization, and they're not made to do that, and that's when you subject yourself to injury.
Yeah, I love that. I mean, I think that's such a good point. And for us as horse owners and riders, I feel like we've been so prone in the past saying, oh, it's been raining for the last 3 weeks, I've got to go leg my horse up. Well, now we know that legging our horses up isn't the only thing that matters. We have to focus on their core as well. And you brought up stabilization, which I also love. And I think we should dig into that for a second. What, if any, difference is there when we're thinking about core fitness between core strength and core stabilization?
Yeah, so I think they go hand in hand, right? And so if you're looking at a muscle, we'll just say the multifidus in particular, and you and I have multifidus and horses have multifidus. It's the primary stabilizer of your vertebral column, right? And so horses have it all the way through their neck, through the thoracolumbar region. It's an epaxial muscle, so it runs right along the spine of the spinous process of the thoracolumbar region or of the cervical region. And then it has superficial and deep branches, and then it has fascicles that will run anywhere from 1 to 5 vertebral segments caudally. So for example, if we start with multifidus at T1, it will send a fascicle from T1 to T2, T1 to T3, T1 to T4, etc. And that happens at each vertebral segment. So you can imagine just the role that muscle has in finite intersegmental stability all along the region of your spine. And so when you look at its role in correlation with its cross-sectional area, so size of the muscle does correlate with strength of the muscle. And so if we look at when horses have pathology in their thoracolumbar region, we do have a substantial amount of evidence that shows that the cross-sectional area of the multifidus muscle will get smaller at that level, at the same spinal level where we have pathology. And so that then results in a weaker area, and that weakness then leads to instability. And then the instability then is further compounded in segments in front of and behind it, and results in micromotion of the multifidus, or excessive motion of that region of the spinal column that it can't stabilize. And so then it relies on other regions or other muscles to provide that stabilization, which again aren't made for that, which then just exacerbates kind of the cycle of back pain, for example.
Moral of the story, as in so many things in life, everything is related. So absolutely. No, I think that's great to understand. And now if you would, let's talk real quick about both athletic performance and also muscle recovery. We touched on the rate of re-injury when core fitness is not properly addressed. And I mean, that makes perfect sense. Re-injury is always the 800-pound gorilla in the room after there's been any number of injuries that the horse has sustained. But let's talk real quick about the actual capacity for achieving peak athletic performance and muscle recovery when there is a proper focus on core fitness. So how does core fitness play a role in each of these areas?
Yeah, I think I think a way to potentially look at it is if we start with an injury, so a lame horse, and that connection with loss of muscle strength and potentially muscle weakness, and loss of muscle size. We do have some evidence, like you mentioned, Dr. Sullivan's work, in which there was a correlation between horses that had chronic forelimb lameness and the atrophy of the multifidus muscle, which I think emphasizes to us as veterinarians to say, hey, we're so focused on the distal limb that we don't assess the horse globally and develop a program that targets not only our pathoanatomical diagnosis, but that global functional assessment and those comorbidities that may have developed. And so do we need to start working on sort of that, what we would consider a core exercise program for those horses that are coming in, for lameness type conditions. And so I think Haley's work was sort of pivotal, or Dr. Sullivan's work was sort of pivotal in saying, hey, we need to sort of examine the whole horse, not just focus on the distal limb. And here's the evidence we have for that. So when we look at then, what does it look like to try and target that muscle weakness component as we bring them back to full athletic performance? It takes some time and it takes some dedication, in that you work on not only the dynamic conditioning of when they're under saddle, but that you also work on the static sort of core strengthening exercises when you're not under saddle, right? And what do those kind of things look at? And certainly we don't know the exact, sequence of events that happens for horses as far as the time frame from muscle loss to then muscle regaining. But when you look at humans in particular, it's sort of a general rule of thumb is that, if it took you 4 weeks of disuse atrophy, if you all of a sudden decided you wanted to be a couch potato from being an athlete, and it took you 4 weeks to lose all that, then you decide to start back to work, it's going to take double of that ability to regain that. So it may take 8 to 12 weeks to gain what you lost in 4 weeks. And so usually we kind of think along those same lines for our equine athletes. If they were laid up for a month, it's going to take 8 to 12 weeks to get our muscle strength back.
That always blows my mind how quickly it goes away. It's a really good lesson for us, for both ourselves, unfortunately, and our horses, to realize. But yeah, it is staggering how quickly you can lose all the work that you've put in, for sure. And I love a point that you brought up about your own work, of course, but Dr. Sullivan's work as well, and so many of your colleagues, where I feel like there's been this shift in veterinary medicine over the last decade or so, where there's been such a greater emphasis placed on the whole horse. And it sounds so obvious, but I feel like in decades of yesteryear, if you will, there was a limb injury in front of you, and that limb injury was really what was focused on. And now the veterinarians are taking a step back and taking this global look at the horse and saying, okay, well, that deep digital flexor tendon is attached to a horse. What's going on? What's happening with the rest of the animal that may have caused this injury, or that may have caused this disease to manifest in this way? And I think it's so important because it tells us that keeping our horses healthy globally is so important for so many aspects. And, especially the one that we're talking about today, core fitness, and making sure that these horses are in top shape. So as we were talking about this, a question was going through my mind. How do we tell? How does a veterinarian tell if a horse is in amazing core, they're an amazing specimen, they're in great core shape, or we've got a lot of work to do with this case? How are they telling with this? Is it primarily physical examination? What are they looking for to really give them the answers in terms of what they need to prescribe or recommend to that client or rider?
Yeah, so it's kind of a multi-complex interplay between a lot of information. We rely a lot of information from the rider, the trainer, the owner, as far as describing, what their riding program looks like, how often do they ride, for how long, and the sequence of events that occur, during a riding session, and how do they feel the horse is doing, right? And more these days, with all of the technology, right, we have riders that can basically show us, here's my GPS, and here's how many miles I rode, and here's the speed at which I rode, and here's my horse's heart rate, right? And here's how the heart rate when we reached max exercise, and here's how well he recovered in heart rate. And there's some really interesting work coming up, looking at the athletic load, like the catapult systems, the inertial IMU systems that are being worn by our human athletes all the time, right? And they're measuring athletic load and player load and performance. And those are being adopted into the equine industry to say, can we utilize these in the same manner, at which we can monitor from day to day how our equine athletes are doing, not only in performance, but how well are they recovering as well. And then there's the functional assessment, right? Just your physical exam that goes beyond just a general palpation, right? When you ask the horse to do certain functional tasks, how do the muscles fire? What's the quality of the muscle palpation? What is the range of motion throughout different regions? What does the range of motion feel like? Is there resistance through the range of motion? Is it a nice slide, smooth gliding surface at which we feel? And so it's kind of a multitude of your normal musculoskeletal exam, your functional exam, and then your dynamic exam, watching the horse go. And more, we're doing exams under saddle, right? So put the horse under load and ask the horse to do sports specific activities and look at the quality of those activities. So all of that kind of together, I think puts the big picture together.
100%. And I mean, the advancements in technology, imaging, diagnostics, I mean, it's all been staggering over the last decade. I mean, wearable technology, gait analysis systems, advancements in biomechanics and high-speed video. And I mean, it can blow your mind. It's like going to an Apple conference when you're in veterinary medicine these days, which is amazing.
Yeah.
But I remember sitting there in this really cool dark room at Platinum Summit this year, and Dr. Cooper Williams was up on the stage, a fellow diplomate in ACVSMR with you. And he was saying, he was going through how cool technology was. Anyone who knows Dr. Williams knows he'll be the first to tell you he's a total geek when it comes to technology, but he really emphasized to the crowd, and especially to younger veterinarians, hey, listen, this technology is rocking. This is amazing, but don't ever lose sight of how your hands and your eyes are your best tools. Don't ever lose sight of how important that physical exam is. And so it was really cool to kind of paint that picture just like you did, bringing it all together. You've got quite the tool chest full of really interesting things at your fingertips, including your fingertips. Go figure. Yeah. Weird how that works. So we're learning now that perhaps also, as we're talking about this, I'm thinking about young horses too. So not just performance horses that have already gone through training, they're competing. We're learning that some of our younger horses are perhaps started a little bit too early in their development these days. And that's, there's hot debate around the subject, depending on what discipline and what breed you're talking about. But we're kind of learning that maybe that's been something that we've been doing as riders. And we're learning now that maybe a little bit more age is a good thing. And there's certainly some things we can take into consideration for younger horses to make sure that we're setting them up from the earliest of ages for a career with a lot of longevity and health in front of them. So should young horses have these core exercises integrated into their program and as part of their development? And how early do you think that that's appropriate? And I know that's probably a tough question because it does differ by breed and by discipline, but what are your thoughts on that?
Well, certainly, I think there is value in a lot of the core exercises that are frequently used, from a rehab perspective, but also from just a wellness and conditioning perspective in the horse that's not recovering from an injury. And I can think of for example, of the young, super gangly kind of warm blood that
Melissa King, I want to point out that was me most of my life. Okay, that young, super gangly warm blood. I'll pay close attention. That 18-year awkward face. I get that. I identify.
So they're just, those guys, their legs are just going everywhere, and they just don't have the muscle firing capacity to kind of keep good motor control. And those guys seem, I have really good luck working those guys in the TheraBand system, right? So just having a proprioceptive stimulus, whether that's around the hindquarters or the one that goes under the abdomen or combined, usually it's, for me, the hindquarter band that wraps around. That, again, it's just a proprioceptive stimulus around their hindquarters that just makes them aware of, oh, there's something around here. I need to engage my hind limb and pelvic stabilizers. It sort of encourages that lumbosacral flexion and encourages them to have more drive and impulsion from behind. Those guys seem to do really well in those kind of things where you just give them just a little bit of extra sort of sensory stimulus at the skin surface to say, hey, you try to use your body in a manner that would be deemed, more appropriate. But certainly things like proprioceptive balance pads for those horses, again, to try to encourage that static core strength in a static position, to gain increase in multifidus size, as well as the other postural stabilizing muscles that are responsible for kind of keeping you in that square stance position. I think all horses, whether injured or not injured, certainly benefit from those things as well.
Where were you when I was in high school? Thanks a lot. Well, no, you actually got out in front of me. I think that was excellent, because my next question was going to be, is there a link between core fitness and proprioception issues in horses? And it sounds like the answer is a resounding yes.
Yeah, there's been again a number of studies in horses, but a lot more in people that have certainly demonstrated that in people in particular, when they conduct proprioceptive balance training, balance perturbation training, when they're injured and they recover from their injury, if they've done those types of exercises, they significantly reduce their re-injury rate in comparison to a group of control individuals who had similar injuries but didn't incorporate the balance and proprioceptive perturbation balance training. They had a significantly higher re-injury rate. And so in our horse population, we have been able to demonstrate that horses that will conduct those proprioceptive balance pad type training can significantly increase the size of the multifidus muscle throughout the thoracolumbar region, as well as they have significant improvements in their postural control, which we've been able to measure objectively. So if you and I stand on a force plate, or a horse stands on a force plate, there are slight adjustments in your base of support to keep your center of mass within that base of support, right? So those slight adjustments in your muscle tension will be measured from the force play as changes or displacement in your center of pressure, right? So if you stand stationary, you don't know it, but your muscles are firing in order to keep you in that base of support. And so when you are unstable, the wider the area you sway within, and the velocity at which you displace your center of pressure changes as well. And so it would be, I'm going to date myself, right? But it would be like when you stand on the Wii balance board and you follow that little red dot all over, it's the same thing. So the red dot is the displacement of your center of pressure. So when horses do those balance pad exercises while they're standing on a force plate through a series of rehabilitation sequence, like I think it was 12 weeks we did it for, they had a significantly smaller center of pressure that they swayed within, so much more stable, as well as the center of pressure velocity improved as well. On top of that, then we had a direct correlation with, as you became more balanced, your cross-sectional area of the multifidus muscle increased as well. So sort of a functional connection between the size of your multifidus muscle increasing, so larger cross-sectional area should equal strength gains, and then that correlated with then an improvement in your ability to stay balanced on an unstable surface. Then there's been a number of other studies that have looked at the application of various proprioceptive devices, right? So Dr. Clayton's done a significant amount of work applying just small tactile stimulators around the fetlock and the pastern area and seeing changes in range of motion. And the changes in range of motion are associated with increase in flexion. And if you increase flexion, you have to increase the activation of the muscles responsible for flexing those joints, right? So it's sort of, yes, we increase range of motion, but we also increase muscle recruitment. And again, it's just a, a sensory stimulus that changes or gives you targeted motor output. And then there's been some studies that have looked at the application of the TheraBands and the ability of the TheraBands to improve spinal stabilization. And so we use these sensory stimulus or proprioceptive stimulus things quite frequently, and are starting to get some evidence to support their use as far as motor outputs or strength gains or proprioceptive improvements in balance, etc.
Well, and I love that you brought up Hillary Clayton's work, because she, like you, is, such a pillar in this world. So, and has done some amazing work to advance the field for sure. And now she is amazing, right? I mean, and as are you. So, I think that understanding the proprioception component of it is so important, but I also want to focus for a second on the back, because I feel like, the back has really come into focus in the last several years as another area of equine veterinary medicine that has really gained in its understanding. And I feel like it's more fully appreciated in recent years, the role of the back, and also that a lot of these lamenesses that we were seeing and pain-related issues can be traced back to the back. That was a great sentence. Write that down. And so explain to me, if you would, because you've done a lot of work in this area, how core fitness can help. Can it help, I guess, is the question, with back-related pain issues, and even as far as things like kissing spines potentially?
Yeah, it's definitely one of those continued hot topics, right? It's one of those things that, sometimes we see sort of those flavor of the months come and go, right? But understanding the biomechanics of the back and its relationship to the appendicular skeleton, I think is an incredibly still ongoing area of research and development, because we still don't, we understand some of it, but still some of it is quite a mystery, right? As far as the interrelationships between lameness and back pain and lameness. We know that a certain percentage of horses with lameness had back pain, and then vice versa. Those horses that were presented for back pain only then had a lameness as well. And depending upon the practitioner and the type of practice, back pain exists or is found in anywhere from 13 to 94% of the equine population. So it is a significant issue that I think we need to face for sure. And I think we think of it sort of like a suspension bridge, or the bow and string theory between the epaxial portion of the back and the abdominal portion of the back, right? So there's an interplay between that as well. And we have been able to certainly demonstrate that there are times in which we treat the distal limb pain, and what we used to think was, oh, the back pain will resolve because it's secondary to the distal limb pain, it is not the case. And when you look to then the human literature to understand their back pain, people, I think the percentage of people is like something like 90% of people will experience back pain during their life. 60% of those with lower back pain will have persistence in disability and functional limitation. And so they've done a lot of work trying to understand the cause and effect and the treatment and the rehabilitation. And they've really looked at what they consider something called arthrogenic muscle inhibition. And it happens anywhere. It can happen in your knee, it can happen in your shoulder, it can happen in your back. But when in the presence of joint pain or inflammation, you then have altered afferent signals from that region that get relayed to the ventral horn of the spinal cord that then inhibit the alpha motor neuron output to the muscle that's responsible for maybe stabilizing or moving the region at where the pain is coming from. And when that pain and inflammation gets resolved or treated, the muscle does not automatically return. And so you have to target the muscle as well, right? So you can't just call a joint injection and be like, okay, we're good to go. You do have to build a plan that says, all right, well, we're going to treat the inflammation within this region, but we also need to develop some exercises that are going to work on the muscles that are responsible for stabilizing and moving that region as well. We have not been able to demonstrate that in the horse as of yet, but there's no reason why that doesn't make sense, right? If you think of it from a neurophysiologic standpoint, it makes sense that the same sort of thing is happening.
100%. I find it so fascinating. And I mean, if there's humans out there, which, just the percentages that you gave in horses, we know that there are humans out there listening right now who have had back pain. They know that there is nothing quite like it, not in a positive way. And with our horses, they're carrying us around, and so yeah. I remember when we had a discussion on here about kissing spines with several of your colleagues. And, I remember Dr. Cliff Hannes saying, gosh, like a lot of these behavioral issues, the quote unquote behavioral issues that we think, our horses just all of a sudden turn sour. He's saying, we got to look at the back because a lot of the time and like Dr. Mindy Story likes to say too, these horses don't just all of a sudden have a personality shift. They're in pain and we've got to figure out how to support them. Right. We're pretty grouchy when we're in pain too, it turns out. So
very much.
Another thing that I'm kind of sitting here thinking as you're talking about it is, we talked a little bit about how to identify as a veterinarian if a horse, it kind of gauge their core fitness strength. As a veterinarian, you can go in and do your physical examination, use the tools in your toolbox. But as we take a step back as a rider and look at our horses and we're thinking, hey, I've got this great exercise regimen with my horse. He's a beefcake. He appears super muscular. Does that necessarily mean that they're in good core fitness?
No, not necessarily, right? Sometimes, big, huge bodybuilders, right? Yes, they can lift 100 pounds, but, or way more than 100 pounds.
They
But
can lift us with one arm.
yeah, that doesn't mean they can go out and run a mile, right? And so there's a balance between muscle size and muscle performance and muscle function, which the cardiovascular system and respiratory system has to equally come into play there. So, like huge halter a good example is those huge beefcakey halter horses. They couldn't trot around a circle, right? And so it just means that they don't have the appropriate cardiovascular fitness and muscle performance. Yes, the muscle size is big, but the muscle performance and the cardiovascular fitness isn't there, right? So it has to be an interplay, a complex interplay between all of those subsystems.
I hate it when that happens, when it's more complicated than it should be like that. Like so many things in life, dang it. No, definitely. So being a muscle man, horse or human, doesn't necessarily mean you've got outstanding core fitness. And I always joke with my male friends and colleagues. It's like if you've ever tried to watch one of those super muscular guys try and do yoga or Pilates or things like that. Makes a great TikTok, y'all.
Challenge. There's your next platinum TikTok challenge.
There's the platinum TikTok
challenge. You
challenge.
get a bodybuilder to do, some funky yoga pose.
You're welcome, everyone, in advance. So you and I we've talked about the importance of core fitness and what that really translates to in terms of performance and recovery. So we've covered that. But the question I feel like kind of remains for veterinarians and riders is, how do we get there? So how do we achieve proper core fitness in the horse? So now we've come to the point where we say, okay, my horse may not have amazing core fitness. I think I've got some work to do here. My veterinarians confirmed it. And of course, we don't have a horse in hand at the moment or under saddle where we can all get an amazing visual. But can you discuss this with us a little bit? Some of the exercises or tools that you go to in order to improve core fitness in a patient. And I know you've talked about a few of them, in specific cases, but in general, what are some of the tools that you reach for?
Yeah. So, like you've already mentioned, this requires, a pretty close relationship with your veterinarian and your team, right? So maybe you have equine physiotherapist on your team and your equine veterinarian, and potentially your massage therapist, your chiropractor, your acupuncture, the whole team, your farrier, someone who works on your nutrition. So there's a lot involved into the team approach. But certainly, relying on your team members to help you out and establish, a working program that's functional for you. There are a number of resources available as far as describing different techniques, or different types of exercises. Dr. Clayton has a really good one out. I think it's Your Horse's Core and Fitness, or Core, Work Your Horse's Core, or something like that. And then there's other sources as well. There are just launched, I think recently, is an app out of a group of human physical therapists that do animal physiotherapy in Australia. It's called EQ Active. That too has a whole host of different types of exercises. But the thing that I would caution just the average lay person is, don't go out and just start doing 10 to 15 of these exercises without consulting your team, your equine professionals, because some of them might not be appropriate for where your horse is at, either in the stages of rehab or where your horse is at in the stage of his career and conditioning. Some of them are way advanced, and not all horses are ready for the more advanced ones. So definitely rely on your team to help guide you through what that process looks like. And just, there's a lot of people that, think, oh my gosh, I want to do everything. Tell me all the exercises. I will do them all, and I will do them every day. And like people, we do know that these exercises are really good for horses, 4 to 5 times a week, but not any more than that. There's been a study that looked at doing them 6 days a week, and they actually lost their strength gains and the improvements that they had. So again, more is not always better. And so consider that as well. So kind of the basic ones are things like all of the cervical, what is considered range of motion exercises, but they also have been demonstrated to improve the multifidus muscle size through the thoracolumbar region. So chin to chest, chin to carpi, chin to fetlock, and then the lateral bending exercises. So chin to girth, chin to stifle, chin to hawk. Those are good, just sort of general what we call baited carrot stretches. Sternal lifts, where it's a reflex response right underneath the girth, where you get the rectus abdominis to contract. They lift up through their back. Things like lateral tail pulls, caudal tail pulls, things that induce isometric contractions. Those are isometric contractions is kind of one of the first muscle activations in which you're just asking the muscle to produce tension without actually moving. That's sort of a very good baseline muscle recovery or muscle rehab exercise in the early stages of muscle rehab. So there's all kinds, and then from there you can continue on. You can do various forms of proprioceptive balance pads. You can use the TheraBands again to sort of recruit abdominal muscles and recruit lumbosacral flexion and hind limb musculature responses. So there's a lot out there for sure. But again, rely on your professionals to help you.
I think that is amazing advice. All of it kind of giving us a little bit of a sneak peek is great, but I think relying on those professionals is a big deal, and the exposure that I've had to you and your colleagues on the rehabilitation front, I feel like is what really taught me that lesson. Is veterinary directed programs are really important. So even if you are working with a quote unquote layperson who may be amazing at running a rehab or directing these exercises, it's really important that in the background you've got a veterinary directed program and you keep your veterinarian in the loop, because they do have such a deep understanding of that horse's physiology. And, there are on the rehab front, I feel like I was able to learn so much about, some soft tissue injuries. They don't belong in a treadmill right off the bat, and a veterinarian is the one, or an underwater treadmill rather, but a veterinarian is the one that's going to be able to tell you what that tensile strength is and make sure that that injury is appropriate to be rehabbed in a certain way. And also when it comes to conditioning your horse. So there are, specialists like you out there. And I want to touch on those specialists for a moment, because ACVSMR, our audience might have heard us mention that a few times, which is the American College of Veterinary Sports Medicine and Rehabilitation, the newest veterinary college, and that with the longest name, is not new on the scene, but it is one of the younger colleges. And I do feel like it has made such strides in this area, and it's growing like mad, the specialty. So, for those that are listening, a lot of veterinarians are our audience, so they're gonna do the eye roll because they know this. But for those that don't, veterinarians, obtain their veterinary degree and then have the option to go on and specialize, just like human medical doctors. So they can be surgeons or they can be internal medicine specialists. They can earn a board accreditation. And now you can earn one just as Dr. King has several years back in sports medicine and rehabilitation. And you brought up the care team, which is also another area of veterinary medicine that I feel like has just really gotten a spotlight shined on it. Partially thanks to veterinarians and partially thanks to some of these incredible programs that stand behind some of these competitive athletes that have really just nailed it. They've done such a good job. And I love walking into those barns because all egos are aside. And it's like, listen, these horses are our number one priority. Veterinarian seamlessly works with farrier, who seamlessly works with massage therapist, chiropractor, acupuncture, body work person, and also boarded specialists like yourself. So talk to me a little bit about the specialty of sports medicine and rehabilitation and how you work with these care teams and the horse's primary veterinarian.
Yeah, well, you really touched upon it, right? The horses first, right? And I think we all recognize that we can't all do it all anymore. So we're not James Herriot anymore, as much as we would like to. But it's to the advantage of the equine athlete, right? And to the owner and the trainer that we say, hey, we're going to put together this amazing team for you that will keep your equine athlete functioning at the highest capacity that we can, right? And to do that, it's going to require, these specific individuals, and more, that's the standard of care, right? That's recognized as that's where we need to be, and that's what we need to do, and in order to put the horse first. And so, as far as what do we bring as sports medicine and rehab individuals to the team? Our expertise kind of lies in the musculoskeletal performance as well as the rehabilitation, but really we as a group of professionals would really like to advance to the point where we're not having to do so much of the injury and rehab, but how do we keep them performing before we get to the point where they're now lame and now they have to recover and rehab. So what does it take to monitor and keep those athletes at a level of fitness that they aren't getting injured, right? So I think that's the ultimate goal of any athlete and any athletic team, is to how do I keep from being injured? But that's where I see sort of the advancement in our small college is getting to that point, or having that bar set where we want to be, where you're not injuring, right? And is that the wearable technologies that help us? Is that the artificial intelligence type of learning modalities that we utilize and come up? Is that what, part of it? Is there advanced imaging? Do we get more comfortable with PET scans, etc.? Never forgetting about our own hands and our own functional assessments as well. But that's where I see us going. That's where we've set the bar.
100%. I mean, prevention really is the ticket. And I think any veterinarian that you talk to will say, I don't want you to need me, in a recovery standpoint. I do not want to be needed that way, because we turn into firemen, veterinarians will tell you, we don't want to put out fires. We want to prevent fires. So I think that that that's such an important thing to really fully understand, is even from a very young age, as writers, let's try and prevent these issues from even becoming issues in the first place. And I think one of the ways, in our world, it's nutrition that we like to talk about, and how that kind of comes into play on how to go back to that whole horse approach, and keep these bodies healthy, and as healthy as can be, from their muscles to their immune systems to their digestive tract. I mean, we know that everything, even this topic, goes back to the gut as well. And keeping these horses comfortable and performing as these top athletes with ultimate comfort, without fatigue, as much as possible, and keeping all of those aspects that contribute so greatly to injury, keeping them out of the equation as much as you can. So yeah, I think that is all so important. And I know in our world, we love to help our clients in a lot of ways, but we would sure rather help them on the front end than when they call us when they have a horse with an injury, and that's never a fun case. So absolutely. I think those are amazing points. So Dr. King, kind of boiling things down as we round out our discussion, what is something that you really wish more riders kept in mind regarding core fitness?
Oh my goodness.
I know that's an open-ended question, but it's better than saying, Dr. King, can you tell us something we don't know about you? It could have been worse.
I think that a couple things, right? I think that we maybe don't quite understand, like in human athletes, they do a really good job at periodization training and allowing the athlete to recover, and looking at the objective measures that determine, can the athlete do the intensity of the workout that we had originally planned today? And then they look at all of those athletic load and player load and all of that information, and they look at, say, no, our athlete hasn't recovered from, the hard workout 2 or 3 days ago. We can't push it that hard. So I think we're much better than we were, but I think we still need to kind of work on that aspect of periodization training and recovery. And then the other aspect is at home, the training that we do at home, does that match the requirement and recruitment of when the athlete is actually in competition? Are we training our equine athletes at home at the same levels that they would be required to meet in competition? And I don't think all the time we are, right? But I think part of that is, how do we measure that, right? Like, how do we measure that? Yeah, we had a workout that would match when we go to the show next week, right? And that's going to require that we use some of these wearable technologies and understand and validate those in order to say, yes, we are training at the same level of requirement than what we would need when we hit competition.
Yeah, I really like that. I think with some of this technology, one of the things it's so good at is allowing us to validate our perceptions or invalidate our perceptions, either way, the former being a lot more fun than the latter. But no, I think that that's a really, really good point, is to make sure our horses are properly conditioned for the job they're going to do when the bright lights are on. And that is definitely something that all of us can stand to focus on, regardless of discipline, regardless of breed. I think that's a really good point. So there you have it, ladies and gentlemen. We could likely spend most of the day and week and beyond discussing this topic, because it touches every one of us, every one of us who rides horses, cares for horses, and treats them. And I feel like it's really gaining in traction as we more fully appreciate the importance of what proper core fitness really means. So Dr. King, as always, your experience and your knowledge is so deep And it's so appreciated by us as writers, and definitely by your colleagues in the veterinary industry. So I'm very grateful, as the entire team at Platinum, that you've lent that expertise to us here today, for sure. So thank you for that, and thank you for being here.
Thanks for having me.
Entirely our pleasure, and I'm sure that to that of our listeners as well. And for those of you joining us, we thank you for spending your time here, learning more about core fitness from the wildly impressive Dr. King. And we hope that you join us again very soon. And until then, I'm Jessie Bengoa. Take care, all.